Welcome back to News 4 at 4. We want to pick right back up where we left off before the break, talking live with St. Louis County Executive Dr. Sam Page. Another question we have for you, Dr. Page. A study from an institute at the University of Washington found that Missouri could be peaking at more than 100 deaths per day in all of this. What is your response to that?
Well, that certainly would be a tragic number if that's where we get. I know that St. Louis County and all of our neighboring jurisdictions, our hospital system leadership, our public health departments are working very closely together to do everything we can to keep that number as low as possible, to make sure that patients who need hospitalization can get the care that they need.
You are a doctor. You certainly follow the trends. You are in touch with all things science. When do you think exactly this peaks here, and when does life get back to normal? The president's saying Easter. Is that realistic in your mind?
No, I think on Easter we're still going to have a little bit of activity in St. Louis County. It's really hard to say what impact our social distancing measures will have made. We know that we implemented them a little bit sooner in the process than most jurisdictions in the country, and we know the curve will be flattened. But by flattening the curve of the peak of patients who are in the hospital, that also extends it a little bit as well. And we'll be watching those numbers very closely, and every day we'll have more information. We'll be able to make a better estimate. But certainly as a medical doctor, as an anesthesiologist, I understand respiratory failure, I understand how this works, I understand the management of ventilators, and this is all very complicated. And we have a lot of data points to enter, and not just testing, which is limited across the country and in our region. It's really hard to make predictions based on those testing results. What we're really watching is the number of people who come into the hospital, and we're also watching compliance with social distancing, because that's really what's going to help us in the long run.
We did check in with the airport today. Still no special screenings from people flying in from hotspots like New York, Washington State, and Louisiana. Explain why that's a good idea.
Well, I think those screenings are certainly helpful. We're spending our activity on interfacing with anyone who's traveled from out of town, making sure that they understand that a quarantine is important if you've been traveling to a hotspot in another country or in the United States. We expect that all of those individuals will be quarantined. A lot of our attention and time right now is planning on excess hospital capacity and following up on people who we know have been in contact with someone who's tested positive for the coronavirus, and getting those people quarantined.
And as you talk about excess hospital space, well, final question for you this afternoon is, how many hospital beds do you anticipate the county needing, and are you taking into consideration the fact that those in rural areas will be using them as well?
Well, we've talked about that. In some of our residents in rural Missouri do depend on St. Louis for their hospital care when they're sick, and we are factoring that in. The hospital systems are building those models, and they have a lot of good health experts helping them predict when the peak will come as far as utilization of our hospitals in the catchment area. The region of the St. Louis metropolitan region and rural counties are part of that formula.
All right, Dr. Page, we certainly appreciate your time this afternoon, all the work that you were doing around the clock. I understand you have a phone call right now with the Missouri National Guard, so we will let you go. But again, thank you so much for your time this afternoon.
Thank you.